Okay, I'm just going to introduce myself. Hi, I'm David. I'm Dr. David Medoff, physical therapist, and we're doing a Periscope interview here with a couple of fellowship and resident students in orthopedic manual physical therapy, and we're just going to get some information about them. Start from left to right. Say hi, Elaine.
Hi, my name is Elaine. I'm also a physical therapist at Austin Manual Therapy, currently in my first year with a fellowship of Manual Therapy Institute.
Cool. And say hi, Lita.
Hi, I'm Lita Rasulian, physical therapist from Austin, Texas.
Great. Hi, Colin J. Hancock. We got 10 people on, aka Bug Lesian and Lee Hutch. Thanks for the hearts. Milo Rangel. I don't know how you pronounce that exactly. Anyways, so let's start with some interview questions here, Elaine. So, what made you decide to do the fellowship the fellowship program in manual therapy?
Well, I actually did two rotations with fellows, and I realized that that is exactly what I want to do. I feel like if the hands-on isn't there, you're doing a disservice to your patients if you're in an orthopedic outpatient setting.
Cool. And what about you, Lita? Why did you start the program? Sorry.
Well, I just mainly felt like I left PT school with a lot of unanswered questions and definitely wanted to get more efficient with my clinical reasoning and adapting the treatments that I use. And I feel like it's definitely been contributing to that. So it's been
Cool. Awesome. Well, we got 27 viewers so far. Thanks for the hearts, everybody. And hi to those of you that said hi. Oh, even more hearts. Awesome. And so let me back up to get you both in here. So open-ended question, you all. We'll try to keep the answers kind of brief so we can kind of move along. Compared to a year ago when you all started the program, can you tell the difference in your skill level and knowledge so far?
For sure.
Yeah, absolutely.
It's like night and day. Efficiency with evaluations and just getting in and getting out is just like seriously night and day. Like I used to like fiddle around and really not know what I was doing and did not know how to streamline my examinations or treatments, and now it's just kind of second nature. It's wonderful.
Awesome. What about you, Lita?
Yeah, definitely. I think so. I mean, looking back at some of the first evaluations I did on some of my first patients, I really wish I had learned some of the stuff I know now, because you're just like, darn, I wish I knew that back for so-and-so. So yeah, it's definitely helped with that. Happy about it.
Great. Brian Law asked, what program is this? Y'all want to tell him the name of the program?
Manual Therapy Institute.
MTI or Manual Therapy Institute.
Mm-hmm. Yeah, and so they're in class right now. It's a lunch break. So thank you, Lita and Elaine, for taking a little time out of your lunch break. I know it's a draining day covering all the information. It's on a weekend. We got to be back here tomorrow as well. So it's a pretty cool program. Why don't y'all tell them about the caseload, the coursework that you have to do, and how you're managing that with work.
Yeah, I mean, that's definitely a challenge. I'd be lying if I said it wasn't, especially, working full time. And it is a lot of information. We have courses about every 8 weeks or so. Sometimes it's every 6 weeks, sometimes every 10 weeks, but typically every 8 weeks. And you're always responsible for all of the material that you've learned before, whether that's the didactic work or the hands-on techniques. Mm-hmm. And so it's definitely a lot to keep up with. And it's, now kind of halfway through, you're really starting to feel the pressure of all the work. So, yeah.
But with the hands-on, you're kind of incorporating it into your treatments, and so it is a source of practice itself. So it's not too much with the hands-on, a lot of just, knowing the information that's given to you. So we do get workbooks every 1 to 2 times that we meet, and we are responsible for all of that information from day one to current. So yeah, just keep up with your studies. You're good to go.
Awesome. So now with work, how do you guys, kind of opening the question, whoever wants to, how do you guys manage the paying for the program and because I imagine you all still have student loans, or what's your situation on that?
Go ahead.
Well, you just have to budget it out. So the MTI program itself is every time that we meet, it's $477, and our company does subsidize us for a certain portion of that. So you can always ask whatever company that you're working for to pay for your continuing education, or that might be included in your benefit package. But yeah, it's all about budgeting, and you know that you're going to be meeting every 8 weeks, so you know that set out $477 for that.
Yeah. Do you know about the total cost of the program, the MTI program?
It's about $8.
It's about $8,100 for the didactic portion in total, and then I believe about $600 to $6,500 for the fellowship hours that you do for the second half.
Yeah.
But yeah, definitely coming up with a budget plan
Yes.
is necessary.
Budget.
And so tell us a little bit about where you guys work.
Well, both of us work at Austin Manual Therapy Associates in Austin, Texas. Everyone that works there is either a fellow through this program or is going through the fellowship. And we have, luckily, a very supportive group of people, and that definitely helps with the program to have that support. So I would definitely advise to try to find a place where either they've been through MTI and have a mentor, because it helps to have people there that have been through the process. You can get through it.
Yeah, they can guide you, guide you in the right direction.
So kind of takeaway point is if you're going to go in some residency or fellowship, you want to be around other people that have done it or are in it.
Yeah, and you definitely want to be practicing within that field too. So it wouldn't make a lot of sense to be, working acute care and going through this program because you can't apply anything, at least most things. So it's definitely helpful to have that patient population.
Right. Awesome. So just talking about personal lives a little bit, do you guys feel like you have to make some sacrifices to go through this program?
I think so. Especially now when now things are starting to build up, but you get used to, you get yourself a scheduling routine for studying and all that, and so you get used to it. If you've been through PT school, you know what it's like to sacrifice for studying, and so it's not a whole lot different. It is harder in my opinion, but not
too bad.
lot.
Yeah, it's not too bad.
Okay. And I encourage any questions from the viewers here. It looks like we got 15 present right now. Please ask questions. Any questions for Elaine and Lita here? So next question, do you get to practice the stuff that you're learning back in the clinic when you get in on Monday?
Yeah, I usually put everything that I learned from the weekend into practice, like almost immediately. First patient, if they're appropriate for it, I'm go ahead and practicing techniques, and then sometimes when we have extra downtime, we'll practice on each other techniques.
Awesome. What kinds of techniques are you guys learning today?
We are going through the hip. We're going through anatomy, physiology, kind of arthrokinematics, special tests, manual muscle testing, mobilizations, manipulations.
Awesome. And what has been, just kind of putting you on the spot, what has been your favorite thing about the program so far? If you had to just pick one thing.
Ooh, that's a good question. A good question.
In my opinion, I feel like the hands-on part of it has been my favorite. Just learning how to tweak, especially your own body to protect yourself biomechanically. I think that is a huge advantage, but also just refining your techniques has been awesome.
Yeah, I would agree.
Cool.
Refining techniques. Yeah.
Awesome. And what do you guys hope to gain out of completing the program?
Well, I just hope to kind of become an expert in my field. My plan is to go through the fellowship hours and become a fellow, which not many people do. I think they were just saying today there's about 1,000 fellows in the country, and so you're definitely reaching that higher level within the field, and so that,
being the best that you can.
Yeah. Now, have you noticed a difference in how many visits you see a patient for since you guys started the program, or
comparative?
Yeah, like as far as the quality of care. Obviously, you guys are doing more advanced level stuff with your patients, but do you find that you're more efficient or with your time?
Yes, like streamlining examinations, like initial evals and also follow-up treatments. It's definitely quicker process now than it was when we just kind of first started off. Like I mentioned before, we're just kind of fiddling, like not really knowing what to do, and kind of, yeah, it was just very like straight to the textbook. But yeah, definitely more streamlined now, and yeah, a year under our belt it's made a huge difference. Yeah.
Great. Hello, Akrep, 65 from Istanbul, Turkey.
Hi.
Pretty wise. And all right, so getting near the end here, unless anybody has any questions. Give me a second. Is there any other questions I didn't cover? I prepped you guys for?
I can't think of any,
Okay.
unless someone else has questions.
All right. Gosh,
I mean, it's overall been a really good experience. I would recommend it if you're just looking for something to make you better, or just refine your techniques, especially in manual therapy and orthopedics in this particular residency and fellowship. So I would recommend it.
It's totally worth it.
I have a kind of a question and a comment. So, this is going to be geared towards people that are looking to do a residency or fellowship in whatever field they decide. It could be neurology or pediatrics, geriatrics, whatever. Would you recommend against going into a residency or fellowship?
I think the only reason I would suggest that is if you mentally weren't prepared for the material. Because if you're not mentally prepared going in, you're just not going to be interested. You're not going to want to do the work, and it's going to kind of be a waste of your time and money. So,
You have to commit.
if you feel burnt out after PT school and you don't feel like you can make it through it, then I would wait to go into it. But other than that, no, I don't feel like there's any other reason.
Mm-hmm. Yeah, I feel like generally people that come to this program are pretty excited about being here and want to learn, and they're not just showing up to go through the motions.
Correct.
So, yeah, I get what you're saying.
Yeah,
sure.
and I mean, financially, it can be a challenge, but, hopefully you work for someone that will help. I mean, most jobs have continuing education money that they'll allot for the year, and you can always apply that towards your residency or fellowship.
Yep. Awesome. Okay, well, that wraps it up unless anybody has any questions. Thank you, Lita. Thank you, Elaine.
Welcome.
All right, let's get some